Medication reconciliation is very important because what happens is that there's at least one omission of medication at every transition of care that a patient undergoes. So you need to have that medication reviewed at every transition of care. And by that I mean if a patient is going from one physician office to another, or from the home to the emergency room, or the emergency room to an inpatient setting, or from the inpatient setting to a rehab. What happens is errors are made in that transition period where we have to reconcile what the patient is on versus the new medications that they're receiving. HIXNY is making the medication reconciliation process possible by creating an electronic health record for the patient, and we're able to validate what medications the patient is actually taking. Up to this point, there's been only the electronic medical record for the individual patient office or the hospital setting or the nursing home. What HIXNY is doing is bringing in the retail medication history as well as the long-term and the hospital medication history so that we can validate with the patient the medications that they are actually on, which is very, very important.
Before using HIXNY, we had to call the doctor's office, we had to call the pharmacy, occasionally we had to call several different pharmacies and then confirm the patient was taking it with a phone call to the provider. Places like certain hospitals, we had to submit patient consent, faxes. Sometimes it took half a day to get one medication list. With HIXNY, if the patient's in the system, we can get it instantaneously.
We utilize HIXNY information on a consent basis for our patients in the emergency room. Many times it's the only information available to us.
We had a patient who came in with the fentanyl patch, and unfortunately it wasn't documented that the patient was on the patch. HIXNY was used and it showed that the patient was on the patch. So it actually prevented errors because of the fact that we then knew or then went looking for the patch. And so we gave the patient less opiate medications at that point.
There's all this value associated with the time involved with medication reconciliation, not just because you're educating the patient and the caregiver about what the patient is taking and why they're taking it, but also because you can reduce the number of medications that patient is going to end up taking. Now, of course, there's value to that monetary value, but more importantly is the value to the patient because they'll always be on the right medications and then they won't be duplicating therapy.
I think in the future we're all going to be under one system. So any physician, patient, nurse can access, or pharmacist can access the information anytime, anywhere. And I think we'll decrease the number of redundant tests and the number of providers that are ordering for the same patient because people will know exactly what the patient's getting and when they're compliant.